Welcome to the Deep Dive. Today we're digging deep into a topic that really touches countless lives, but is often, let's say, surrounded by more myth than actual fact: kidney health and disease. What we want to do is take the material we've looked at, kidney disease, symptoms, treatments, and truths, and pull out the really important bits, help you get genuinely informed without getting lost in all the medical terms.
Yeah, we're going to try and cut through some of that noise, clear up common misunderstandings, and hopefully empower you with, accurate information you can actually use. And you might be surprised by some of the truths we find right off the bat, especially about what it actually means to live with kidney disease. Okay, so let's unpack this a bit. Before we jump into symptoms or treatments, let's maybe tackle some of the biggest misconceptions first. These things around kidney health. Some of these facts are quite surprising, directly challenging those sort of long-held beliefs that can cause a lot of unnecessary fear.
Absolutely. There's this widely held belief, probably rooted in older thinking, that using things like artificial kidneys or peritoneal dialysis will actually make a patient's condition worse or even shorten their lifespan. This is a really critical point to clarify because, well, it's just not true. The truth is, these treatments, dialysis, in its different forms, they actually remove the toxic waste from the body. They're essentially stepping in and doing the kidney's job. And this significantly improves the physical condition. It lets patients get their strength back.
Right, so it's not just about extending life, it's more about restoring a full life,
Hmm.
kind of challenging that old idea of being perpetually sick or having a limited future.
Exactly that. Patients who get regular and adequate treatment can live long lives. Often they can work normally, they can be pillars for their families, contribute to their communities. It really is about restoring the quality of life, not just, tacking on more time.
That really does shift the perspective for a lot of people, doesn't it? Okay, now, what about the other side? Those incredibly generous people who donate a kidney. Does that huge commitment shorten their own life or leave them somehow vulnerable? And especially given what you just said, what's the real story about kidney donation itself?
That's another really common misconception. The idea that donating a kidney, say, to a relative, will somehow cause the donor to have a shorter lifespan than average. But think about it. Humans have two kidneys, right? And one kidney, all on its own, can function completely adequately for the body's needs. I mean, lots of people are actually born with only one kidney, or they might lose one because of an accident or some disease, and yet they live perfectly normal, healthy lives. No kidney-related symptoms.
Huh, so it's not like donating them puts you at some kind of permanent disadvantage. Your body really just compensates.
Precisely. Their bodies stay perfectly healthy, just like anyone else's. And what's maybe even more profound, something highlighted in the material we looked at, is the huge positive impact. Donating a kidney isn't just seen as a medical thing, it's described as, well, the most noble act of charity and the most effective way to literally give new life to someone with kidney failure.
That's quite a powerful statement.
Yeah.
How does that actually play out then, for both the person receiving the kidney and the donor?
Well, for the recipients, they're basically given a second chance at life. They can live happily, they can earn a living again, support their families, become, pillars of support. And this new lease on life often leads to this really deep appreciation. It can inspire them to become more generous themselves, more compassionate, wanting to benefit society. And for the donors, they experience this immense fulfillment from their charitable act. Plus, they often receive recognition and praise from society. It's described as a truly transformative experience, really, for everyone involved.
Okay, so with those kind of surprising truths about treatment and donation clearer, let's maybe switch gears. Let's talk about something equally vital: figuring out what your body might be telling you. Because recognizing potential issues seems tricky, right? So many symptoms aren't only about kidney disease.
You're absolutely right. It's very easy to mistakenly think certain symptoms point straight to kidney problems when actually they could be caused by a whole host of other conditions. The key really is understanding the specific signs that genuinely warrant immediate medical attention.
Right, so let's break down abnormal urination then. What are the really key things to watch for there? The ones that should raise a bit of a red flag.
Okay, first off, we need to pay special attention to blood in the urine. It might look red or sometimes even kind of flesh-colored. This means blood is mixed with urine, and it could come from some serious causes like kidney inflammation, kidney stones, even kidney tumors or cancer, or maybe bladder stones, or inflammation down in the bladder or urinary tract. It needs checking. Another really significant sign is dark brown urine. The source material describes it as resembling the color of fish sauce, which is quite vivid. This dark color is commonly found in patients who have acute kidney inflammation. It happens when blood from the kidneys undergoes a kind of chemical change, altering its appearance drastically. But it's important to note it can also sometimes be a symptom in patients with certain liver diseases who have jaundice. So it's not exclusively kidneys. And lastly, cloudy urine. This often points towards infections and inflammation, either in the kidneys or perhaps the bladder.
Fish sauce. Yeah, that is a vivid comparison. Okay, what about more general urinary issues like needing to go really frequently or having difficulty urinating? Are those always immediate kidney red flags, or could they point elsewhere?
Not necessarily straight to the kidneys, no. Frequent urination, for example, doesn't automatically mean kidney disease. It could be due to something like diabetes, especially with high blood sugar levels, or it might just be an irritated bladder or a simple urinary tract infection causing that feeling. Similarly, difficulty urinating. That might happen because of inflammation or some kind of blockage in the urinary tract, maybe bladder stones blocking the way, or particularly in men, an enlarged prostate gland. So while they're definitely worth noting and checking out, they aren't exclusively kidney symptoms.
Okay, and then you've got those really general symptoms that could honestly be anything, like swelling or back pain. These seem so common for all sorts of minor and major issues.
Precisely. Take swelling. It doesn't just happen in kidney disease patients, not at all. It can also be a sign of heart disease or liver cirrhosis, malnutrition, even lymphatic obstruction, or maybe a thyroid hormone deficiency. Lots of possibilities. And as for back pain, well, yes, it might be found in patients who have kidney inflammation or kidney stones, but honestly, the most common causes are usually spinal disorders, problems with the back itself or back muscle inflammation. So just having back pain doesn't necessarily point straight to kidney disease.
So what this all really underlines, I guess, is how critical getting accurate information is, and why trying to self-diagnose based on one or two symptoms can be so misleading, potentially even risky, which leads us to a more serious point. What actually happens when prevention or early detection, well, hasn't worked and kidney failure does occur? Chronic renal failure? What are the main paths forward then?
Right. If we link this back, when kidney failure happens, chronic renal failure, the body basically loses its natural power to filter out waste effectively. The material we reviewed outlines three main treatment approaches. They're all forms of dialysis or replacement therapy, essentially ways to artificially filter the blood and get rid of those waste products the kidneys can no longer handle. First, there's hemodialysis. This is often called using an artificial kidney machine. It involves passing the patient's blood out of the body through a filter in a dialysis machine and then back into the body. Patients typically need this maybe 2-3 times a week, and each session lasts about 3 to 5 hours, usually done in a clinic. Then there's continuous ambulatory peritoneal dialysis, or CAPD. This is different. It uses the body's own peritoneal membrane that's the lining inside your abdomen as a filter. How it works is a special dialysis solution, about 1,500 to 2,000 cc, is introduced into the abdominal cavity through a catheter. It stays there for about 4-6 hours. During that time, waste products from the blood pass through the peritoneal membrane into the solution. Then the fluid containing the waste is drained out. That whole process is one cycle, or exchange. And patients typically need to do this 4-6 times every day, but they can often do it themselves at home, which offers more flexibility. And finally, there's kidney transplantation. This is pretty straightforward conceptually. It involves surgically placing a healthy kidney from a donor, either living or deceased, into the body of the patient with kidney failure. This new kidney then takes over the job of filtering the blood, replacing the function of the old kidneys that have stopped working.
It really is remarkable, isn't it, what medical science has made possible, offering such different pathways forward for patients facing kidney failure. So, wow, we've covered quite a lot of ground today, from, busting some of those myths that cause so much worry, to clarifying what symptoms really matter and understanding the main treatment options. What would you say is the most important sort of practical takeaway for someone listening to all this information?
Yeah, that's a really important question. What's the actual advice here? The source material gives some pretty clear recommendations, actually. It basically says if you experience any of those abnormal symptoms we talked about, especially things like blood in the urine or that dark brown urine, you really should consult a doctor immediately. It's just vital to find out the exact cause and get the proper treatment started.
So it really boils down to being informed enough to know when to seek professional help, right? Rather than ignoring symptoms or letting them get worse, or maybe believing incorrect information from, non-medical people.
Exactly. That's the core message. Good kidney health care really starts with having the right knowledge and understanding. And knowing that talking to doctors when you're in doubt, that's always the best first step. It's all about being informed and proactive about your own health.
That was genuinely insightful, a real deep dive into kidney health. It's just amazing how much difference having accurate information and a bit of clarity can make. It really can empower people to take better care of themselves.
It really is impactful, isn't it? Just knowing the facts can get rid of so much fear and replace it with, well, concrete understanding and a clear path forward if needed.
So here's our final thought for you to maybe mull over. Considering how absolutely vital organs like our kidneys are, and yet how common some of their symptoms can be for totally different conditions, how much do you really understand about your own body's internal workings? Beyond the obvious stuff. What other areas of common knowledge, things we maybe just take for granted, might actually benefit from a deeper fact-checked look like this? Just something to think about. Remember, good health really does begin with good knowledge, and crucially, knowing when it's time to consult an expert.